When we think of joint replacement surgery, we typically think of knee or hip replacement, but thousands of people are having their shoulders replaced. Here to explain more is Dr. Craig Foster, an orthopedic surgeon at MidState Medical Center. Doctor, thank you so much for being here.
Good morning.
So how many people in the U.S. are having this surgery done?
About 50,000 a year. And as compared to total knees, which is almost 600,000, and total hips are about 300,000.
Wow. And you've done thousands of these surgeries yourself.
I have.
Yeah. And why are people coming to see you? What typically causes this problem?
This is a problem of arthritis in the shoulder. The reason there's not as many of these as there are hips or knees is because it's a non-weight-bearing joint. The pain is the #1 criteria for doing it. So you have to have arthritis, massive rotator cuff tears, or pain, but pain is the most important.
Now, are there any treatments prior to surgery that you can do?
Yes, oh yes. Physical therapy, anti-inflammatories, injections, conservative care.
Yeah.
And then the surgery is a last resort.
If all else fails.
Yes.
And you brought some models here. Explain to us what we're looking at.
This, the first model is of a shoulder. This is a right shoulder.
Okay.
And the main reason I brought this is to show you what a complex joint it is. The joint is the shoulder is a wonderful joint, having the greatest range of motion of any joint in the body. And you can see all the muscles around it. When we get an arthritic joint, we have two different types of prostheses, basically, that we use.
Okay.
The first is a standard shoulder replacement. This is an example of a humeral component that's modular.
Okay.
The most important parts of replacing a joint today are the experience of the surgeon, the alignment of the components, and the materials used. In the beginning, 40, 50 years ago, shoulder replacements were one solid piece of metal. Now we have modularity to it, so we can adjust the prosthesis to fit the patient.
I see.
This is a standard shoulder replacement where you have a component of the humerus is into the bone, that's this piece, and then we have a liner to the socket.
Oh, it fits up so nicely there, right?
It fits well, and the rotator cuff goes over it. That's these muscles. So there's only one muscle that gets violated when we do this procedure.
And Doctor, how long would a patient need to recover from this surgery typically?
It takes about 3 to 4 months to get about 80% recovery. It takes a full year to forget
the whole
about
range
it.
of motion, okay.
And they're usually in the hospital for 1 to 2 days.
Okay, very good. And how does this one differ?
This one is for people that have arthritis with a massive rotator cuff tear where there's no muscles around to hold the joint together. So the ball part, instead of being on the humerus side, is on the socket side. And then the socket is into the bone. So it holds together by tissue tension, and it's not dependent on the rotator cuff.
Got it. And Doctor, lastly, why would patients choose MidState Medical? It's a convenient hospital, first of all.
Well, it is convenient. We're right in the middle of the state.
Right.
But we have fellowship-trained orthopedic surgeons that are trained in shoulder surgery specifically. We do quite a volume. It's a small hospital, but we subspecialize, and this is one of our specialties. And we recently received a Joint Commission Certificate of Excellence for
nice.
joint replacements. So that's those are many of the reasons for coming to MidState.
Very good. Dr. Foster, thank you so much for being here. Thanks for explaining the surgery to us. And of course, for more information, go to midstatemedical.org or call 1-800-DOCTORS.